A nurse at Sinai-Grace Hospital says he was fired for something he didn't do at the height of the outbreak. Now, these images of body bags stored in a room went viral, and the nurse says he was fired because of it. Sean Lay joins us live this evening, and Sean, he says he didn't spread those messages.
He's insisting that. We spoke to this RN just minutes after he was fired and walking out of the hospital. He was very emotional, and he says tonight he is heartbroken.
Early this morning, Sinai-Grace RN Sal Hedwan shot this video of himself leaving after his overnight shift, saying the DMC fired him the moment he was done today.
But they decided to terminate me because they think that I leaked the photos to CNN.
Shocking photos of COVID-19 victims stacked up inside rooms at Sinai-Grace. Hedwan says he did not take or share the photos with news outlets. He showed us his termination papers. The DMC says an investigation into the photos was launched and found Hedwan in violation of multiple policies, including the handling of confidential information. And again, he denies sharing the photos.
Whoever shared it actually kind of went too far because nobody should see their loved ones like that.
Hedwan did post a Facebook Live in early April of he and his overnight shift of nurses walking out of Sinai-Grace in protest of what he says was dangerously low staffing levels, putting waves of coronavirus patients at risk. He says he knew he was risking his job then, but had to speak up.
Patient safety was compromised so much. We needed to be heard.
Tonight we're asking the DMC because we're hearing that other nurses who may have been involved with the picture have also been fired. The DMC says, quote, our ethics hotline received complaints that employees had taken inappropriate photos of deceased patients at Sinai-Grace Hospital and shared them with other employees. We conducted a comprehensive investigation and took appropriate action based on employee admissions of violations of our patients' right to privacy. We have an unwavering commitment and obligation to respect the privacy of our patients and treat them with dignity and respect. We do not tolerate actions to the contrary. I'm sure we'll hear much more of this in the days ahead. Back to you.